Welcome to the EADV podcast, the official podcast of the European Academy of Dermatology and Venereology. I'm Adriana and I'm your host. Every month, the JEADV chooses and highlights 4 articles in a section called Editor's Picks. Today we explore the Editor's Picks for August 2023. Accelerating wound healing by decreasing interleukin 17. Can gummy smile be cured? Promising relief for chronic kidney disease-associated pruritus. And hair loss after COVID-19 infection. But before we get into it,
get ready to experience cutting-edge science and innovation in dermatology and venereology at the upcoming EADV Congress in Berlin, Germany, 11th to 14th of October 2023. The EADV Congress is one of the largest and prestigious international gatherings dedicated to dermatology and venereology, providing a platform for the brightest minds in research, clinicians, and top industry professionals to come together and share knowledge, make connections, and foster scientific collaboration. The diverse interactive program covering the full AZ of hot topics also includes innovative hands-on workshops, subspecialty sessions, and industry sessions. The exhibition hall will provide opportunities for attendees to explore the latest technologies, treatments, and products in the field to date. The wait is over. Tickets to attend the Congress in Berlin are on sale now. Be sure to check eadvcongress2023.org to learn how to participate and for more information about the event.
Did you know that JEADV Clinical Practice has an open call for papers on skin diversity? With a patient-focused approach, EADV's open access journal aims to address the underrepresentation of skin of color in dermatology practice and research. We welcome a wide range of submissions for this special issue, including original and review articles, case reports, and more. Submit your proposal to jaecp@eadv.org. Final manuscript submissions are due by the 30th of November 2023. Don't miss this opportunity to contribute to the representation of all patient populations. Find out more on eadv.org.
And now, the editor's picks.
Article 1. Accelerating wound healing by decreasing interleukin 17. Although wound inflammation is considered to be important in modulating healing, targeted strategies to accelerate the closure of chronic wounds have been understudied. Inflammation is a well-known etiology of venous ulcers, which involve significant morbidity and economic burden. Previous findings in mouse models revealed that anti-interleukin 17 therapy accelerated healing. Cox and colleagues assessed blocking interleukin 17A to be a specific strategy in treating venous leg ulcers following previously reported success in preclinical models. In their phase 2 randomized double-blind placebo-controlled trial, anti-interleukin 17A therapy was well tolerated and did not induce major side effects, particularly in terms of infection. Anti-interleukin 17A therapy resulted in a 64% reduction in wound size on average in a group of venous leg ulcers resistant to conventional treatment. As shown in Figure 1, resolution of venous ulcers was observed in the treatment group. These interesting preliminary findings should be validated in a definitive Phase 3 clinical trial. The authors acknowledge that the small sample size was limited by recruitment issues secondary to the COVID-19 pandemic and initially narrow eligibility criteria. Article 2. Can gummy smile be cured? In the last few decades, minimally invasive procedures such as botulinum toxin injections have replaced invasive surgery's correct gummy smile. Despite the extensive literature on the reversible effects of this treatment within 4 to 6 months, there are few reports on the cumulative and long-term effects after years of treatment of gummy smile using botulinum toxins. Hexel and colleagues noticed that in their years of clinical experience, several treatments with botulinum toxin type A over a span of approximately 10 years can lead to persistent resolution of gummy smile, as shown in Figure 2. By prolonging muscle paralysis, which leads to muscle atrophy and a long-term decrease in contraction of the levator labii superioris olecquinase muscles, the action of antagonist muscles are favored. This gradually leads to upper lip ptosis when the patient smiles. The authors propose that these treatments also act synergistically with the natural elongation of the upper lip that occurs with aging. The exaggeration of this effect remains to be defined. Article 3. Promising relief for chronic kidney disease-associated pruritus. Chronic kidney disease-associated pruritus is common in patients on hemodialysis and stands as a challenge to several different specialties of medicine, from dermatology to nephrology and general practice. It adversely influences not only quality of life, but also morbidity and mortality of affected patients. Up until recently, the standard of care for treating chronic kidney disease-associated pruritus consisted mostly of off-label medications that lacked quality evidence. Kraft et al. Share some of the first real-world data of patients receiving the new drug diflaxofilin, a kappa opioid receptor agonist that is now approved for the treatment of moderate to severe chronic kidney disease-associated pruritus in hemodialysis patients in the US, EU, Switzerland, Canada, Singapore, and Australia. A total of 15 patients from 4 European countries were treated in this study. The majority demonstrated a reduction in the worst itch numerical rating scale by at least 3 points, as well as improved quality of life with mainly mild adverse events, indicating that DFK is effective and well tolerated in treating chronic kidney disease-associated pruritus. Article 4. Hair loss after COVID-19 infection. Although the World Health Organization just formally ended the global health emergency regarding COVID-19, the pandemic is still with us and so are its effects on patients. SARS-CoV-2 infection may cause telogen effluvium with dermal fibrosis and a persistent decrease in hair density in susceptible people, even though the majority of cases are self-limiting. Michelini et al. Described the features of COVID-19 related TE in 4 female patients presenting with acute hair loss occurring 1 to 3 months after the onset of SARS-CoV-2 infection. Clinical evaluations included pull test, trichoscopy and trichogram assessment, and histology was performed by punch biopsy. Figure 3 shows images of clinical and histological photographs. Histopathological features include thickened nerve trunks and fibrosis. The authors explain that while the pathogenesis needs to be clarified, the cytokine storm may cause fibrosis by activating toll-like receptor 4 via damage-associated molecular pattern molecules and enhancing tumor necrosis factor alpha, interleukin 1, interleukin 17, transforming growth factor beta, interleukin 5, interleukin 4, and interleukin 13. Our first article was Anti-interleukin 17A exicizumab for treatment-resistant chronic venous leg ulcers, a phase 2 randomized double-blind placebo-controlled pilot trial by Cox and co-authors. Our second article was The Long-Term Resolution of Gummy Smile with Repeated Injections of Botulinum Toxins by Hexel and co-authors. Our third article was The First Real-World Experience of 4-Diflaxofilin to Treat Chronic Kidney Disease-Associated Pruritus in Hemodialysis Patients by Kraft and co-authors. Our fourth article was Telogen effluvium in SARS-CoV-2 infection, Histological Aspects by Michelini and co-authors. Of course, all of the research presented today can be found in the Journal of the European Academy of Dermatology and Venereology, and though you can find free access and open access articles, EADV members benefit greatly by having access to all articles and content. We would like to give a special thank you to all of our listeners. If you haven't already, make sure you subscribe on Apple Podcasts, follow us on Spotify, or otherwise you can find us on any major podcast provider.
Before you go, a quick favor. If you're a regular listener of our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you are interested in hearing. To participate in this short survey, simply follow the link in the show notes of this episode.
We appreciate you joining us and look forward to presenting more interviews, research, and topics of merit. Until the next episode, take care of your skin.